You can see how I start making my notes. So whenever I solve the MCQ and I got any kinds of new things, like solving MCQ on the vital sign, and daily I got new pearls. So I try to write all the pearls together in my diary, and then I therefore skip 2-3 pages, and whenever my full preparation I got any kind of pearls, new pearls, I start to add here. So you can see that after completing this page I got still now many more types of pulses and in which disease condition it is occur. So hello everyone, I am Nabeena and I am student of MSc Nursing final year in AIIMS Mangalagiri, and currently I am pursuing oncology nurse. Student request me that ma'am, how to practice MCQ with theory and how to revise the notes. That's all thing together is very difficult to do. So this video will be, I will try to keep this video short as possible. Just in this video I will share my time when I am taking preparation, how I divide the time, and notes, how I make my notes at that time. I will show you my note. In my hostel only I have one notebook, so I will try to show you my notebook also. So first let's start the video. So first thing, if you are reading big nursing books but still you are getting the less marks, means the technique you will follow for reading or revision, it is not the perfect or right. So first thing is you divide your time and subject. First you saw how much time is there in your hand from starting today to the up to the exam. Then you divide your subject according to the time. Like medicine is the first subject area, so you give more time in medicine. Other subject like pediatric, obviously these are the small subject, try to give less time, like few weeks, you just give 3 weeks like that, not fully 1 month is also not need. After that divide. Then in medicine also you have to divide different system, that today I am going to complete these 2 systems, so according to this system you divide. So after I complete this full division, I start reading. So now I'm going to start from medsearch. So in medsearch, if I decide that today I'm going to complete the neuro, so in early morning I start seeing the lectures, whatever available in YouTube, or the portion what I feel tough in that portion, and I make the notes when I read the books or see the video at a time. So it takes quite a long time because making notes and seeing videos together is really tough. Then after completing this full neuro, you just go to the MCQ, whatever books you have, MCQ books, you solve all the neuro questions from these books. Or no, if you have 2 books, try to solve 2 books. If you have 3 books, try to solve 3 books for the neuro system. So one advantage is there, that after reading immediately when you try to solve the question, you see I think 70 to 80% question you able to do the right. Okay, and some question is there you feel it is tough or quite new. During also theory portion you never see this kind of question, you just make the notes of this question in your notebooks. So where you complete the neuro notes, after in the down portion you add these all questions with the answer. And also in MCQ book also you put a round circle or any kind of mark for these questions which you feel tough. So like this wise I complete my all the MCQ practice together with the theory. After that in evening time or night time I try to revise the things which I feel tough or which things I learned today new. These all things I try to revise. Then come to the next point. So how you do the revision of the MCQs, like in target hyper there is too much MCQ, so each and every day no need to revise this full 1000 questions. So first time it's take really huge time when you solve all the question, but from second time onwards it's literally take the very less time, because you only revise those question you marked the last time during your solving. So only this question you just revise and you see you are able to do this time also or not. So if you see you are able to do this time, you just erase the marks from the question. So that's in this type you see when you revise 4 times 5 times, at that time you have very few question, and just in one day you are able to complete full medicine in target high or PR. So that's how I make my notes. Actually from starting I don't have any plan to make notes, but when I find the things tough or it's very difficult for me to recall, I try to notes all these things, and when I make these notes I keep 2-3 page blank, and then I start to make the new topic notes. So in between my preparation, whatever things related to this topic I got, I add in the blank pages. So let's see my notes. Start making note from the medical surgical nursing, because I found this is the very first subjects. So you can see, so during the preparation I got question on the breath sound. I start making notes of different kind of breath sound, and where I can hear this thing, like here is the MCQ, you see monophonic fixed wheeze is heard in. So this kind of MCQ I found difficult, so I write in down portion of my notes. Then here again one MCQ I got, so I add here. So not only the notes, okay, and notes means not like the paragraph wise you are writing, only the term and the one line of the meaning and the related disease condition of this thing. So I make my notes with different color, different pencil, and I also add all these MC. So these are all continue of the breath sound, and these all are the question very important because I found this question coming repeatedly. This emphysema, which kind of breath sound, decay, increase ICP, congestive heart failure. So this question coming repeatedly. Then I saw lumbar puncture. They are asking very few question. It is very easy, but if we don't know, then we will not able to do the easy question in the exam also. So like the needle, they are asking the which needle gauge is which color coded. So this is applicable for all things like IV cannulation, oxygen masks. So I make a short like these 2-3 page notes on the lumbar puncture. Then whatever one circle of wheels, they asking the question, 1 or 2 question I got, so I make a circle of wheels, and it is easy for me then seeing the images. Then this is some muscle. So in muscle also they are asking question, 1-2 question, what is myoblast, these things. So I draw and make a note. Now here come the important one. I got many question on this topic, like total number of muscles and different kinds of muscle, largest muscle, longest muscle. So I go make a list of these muscle, different kinds of muscle, and the muscle related any MCQ if I got, I add all these things. So this one page note is very easy to recall. You are if writing these all things repeatedly in different pages, so it is tough. You can make all these things in one pages. Again, one thing like different kinds of joint, I got different questions especially for this thing, condylar joint, ellipsoid joint, saddle joint, ball, and so again I make a notes of these things. So I think you got different question from diet also. So I tried to list all kind of diet whatever I got during my preparation, cholelithiasis, pancreatitis. So actually this is all MCQ explanation. I wrote all things in this one page. Then I found different kinds of abdominal incision used in different surgery. So I wrote in one page. This is renal diet used in different renal condition. And if you are able to see this one liner, these all things I got in MCQ. So in this way I wrote all this. So now if I saw you my mental health notes, like there are different kinds of phobias. This is very easy one, so you can make one note. So later I got more phobias, and here there is no pages, so I add this white small space. So in each and every things, when I get more things but no pages there, I add like this with a pin. I add all this. In psychiatric also, this neurotransmitter, they ask question in which disorder it is decreased and which disorder is in. Then psychiatric drugs are very important. So these all red things I got in MCQ. After making notes, I start getting different kinds of MCQ. So I add all these question, and in our time in MCQ MSc nursing, we got question from here 2 to 3. Like from here we got one questions, I remember. And these all things, this during practice MCQ, these all things question, this is the things we got in. And these question comes from phenazine, from our AIIMS MCQ, the mode of action they ask. So this is different kinds of things who coined the term. So there are many questions during NNL MCQ I got. Again I make this all name of this person and who coined which term. So here one question I got from the schizophrenia, good prognosis and poor prognosis. I got one question from here also. The negative symptoms find in which kind of prognosis. Then this is all the things I got in MCQ. And in our time also we get this easy question, that in MMSC how much score is there. So this kind of easy question also we get our exam time. So in psychiatric, I don't know, NNL I found some tough because they are asking many tough questions like different kinds of syndrome. So I start to make all kind of syndrome notes. This is the all syndrome. This I first time heard all these syndrome during my MCQ practice. I keep all things in, so all together in a same pages. So actually foundation of nursing as a subject, it is again a carry very good marks, very easy subject, but they ask many questions. So again you make notes of this subject also, especially the different kinds of marks they are using. And then the acid base balance, they are asking very easy questions, so you need to know all these things. And the other things like enema, different kinds of other oxygen delivery system, different kinds of dressing, you can notes. different kinds of position and different kinds of measurement scale. I also post photo in my YouTube channel. You can see different kinds of pen scale is there. They ask question which pen scale used for which age, so this kind of thing you need to make a note. Then come to nursing management. So this kind of graph they ask in question, so these all graph I draw together to make notes. Then cranial nerve, a very important topic in medicine as well as foundation of nursing. So this kind of thing you make a notes, and whatever MCQ you got during your MCQ practices you just add here. So next time onwards you try to make it in a big page, and all things you add. Like in our AIIMS MSc nursing they ask this question from cranial nerve 1, loss of smell, anosmia. So these are the very important topic. They ask 1 or 2 questions. This kind of question also I got many times, color coding of the gas cylinder. Then they ask image based questions, especially instrument. I also got my time also. These things I make notes. Whatever the instrument I got during my MCQ practice I draw and make a notes like. Then from here we got one question in our time in exam. Different kinds of pressure is there. So ask the attitude cup pressure, and you know I did the wrong answer because here is two kind of pressure. One is mmHg and one is semi H2O. So better you make a note all kind of pressure in two values, mmHg and cmH2O, because they can ask anything. So what if they ask mmHg and sometime we give answer in semi H2O, because they keep these two kind of option in their MCQ. So better to make a good notes on this. So next I got many image based question, and I think also you people saw during preparation. So in ECG they ask many image based question. Our time also we got question from ECG. So you make all kinds of graph of ECG, and then the MCQ whatever you get try to add. So different kind of ECG, see how I add the notes, how I draw all the heart, and then I add all these points. So these are the thing question I got different time in my practice. So another, the last most important thing, that's the triad, different kinds of triad and the quadrats. So during your time I think you also get different kinds of triad. We know few things, but in MCQ practice I got different kinds of triad, tetras, these kind of things. So you also try to make a notes on these things. I will show you this thing. First I start some little bit question here, but slowly I got many questions. So I think it is very difficult without making notes to recall. So I make all kinds of triad, and here this question we got, and actually really it is successful for me because I got one question from here during my time. So when I got the question in AIIMS, okay, though I am feeling very happy that maybe it is worth it making too much notes. So you think different kinds of triad is there. Maybe during our BSc time also we don't know, but in NORSET and in AIIMS it is really very much. So these 19 triads I got, and next come to the tetras. So in tetras again one question come during our time, this TOF. So maybe they ask which is not the come under this triad or exceptional, you have to find. So these things comes on the all the triad. So actually again after making notes my page was completed. Again I have to add these things. So these things again I start getting this kind of 3C, 3P, okay, 4P, Pellagra, DM. So I show you how I make notes and how I revised all these things daily, and how I make notes during my making my real notes. So together side by side I do all these things, and you also try to do all these things. Definitely will get 100% question from there only, because I also show you different question I got from my notes only. So if you try to this follow in a perfect way, definitely your making notes is worth. So last thing, if you want any kinds of help in making notes or any topic, if you want you can comment me. I will definitely try to post in my YouTube channel, and there already I posted many things. You can go and check all these things, and many MCQ I share in my channel. So try to solve all these questions. Maybe these are from moderate to tough, I know, but you can try. Okay, bye friends, and comment or like my channel if you like this video.